Have you ever wondered what you would do at the scene of a motorcycle crash? Road Guardian's certified instructors teach treatment using the acronym cABCs of trauma. Take it away, Paul.
I'm going to talk about the C in ABCs, how to stop an arterial bleed and an armor leg fast to keep them alive. I'm going to use my gloved hand and then a cat tourniquet. First thing I'm going to do is put pressure on the bleeding with my hand. The pressure may stop the bleeding or just slow it down. If it doesn't stop, I'm going to apply my cat tourniquet to cut off the circulation and stop that catastrophic bleeding. I apply the tourniquet, twist the windlass until the bleeding stops. Apply the Velcro, time strip, write the time down, bleeding is controlled.
A, airway. If the tongue is blocking, with trauma, we don't use a head tilt, we use jaw thrust. But if the helmet is interfering with managing the airway, we must take it off.
You have an unresponsive victim who has a pulse, but you're not sure if they're breathing. Look, listen, and feel for breathing for 10 seconds. 1,000, 2,000, 3,000, 8,000, 9,000, 10,000. They're not breathing, so you use your pocket mask and the jaw thrust to open the airway. Give 2 initial breaths, looking for chest rise, then 1 breath every 6 seconds. 1,000, 2,000, 3,000, 4,000, 5,000, 6,000. And that's risky breathing.
C is for circulation. Scan the body for obvious bleeding. Don't forget to wear your gloves. Remove jewelry, apply pressure dressing, and elevate. Remember, once you apply dressing, do not remove it. When a pressure dressing and elevation fails, a hemostatic dressing can be applied, commonly called quick clot. For massive bleeding to limbs, a tourniquet should be applied.
S is for shock, and everyone on scene is going to feel it. Your body holds about 5 liters of blood. The abdomen alone can hide about 1 liter, and losing 2 liters is critical. Think hypovolemic shock, that's blood loss, and it's not always obvious. Neurogenic can come from head or spine injuries, and psychogenic, the emotional shock, that's where we can help the most. Stay calm, keep your voice steady, and keep talking, even if they're unconscious.
Last but not least, the second S, spinal stabilization. If you suspect a spinal injury after an accident, you may have to maintain spinal immobilization. Simply hold the person's head like this so they can't move their head around. If they're wearing a helmet, leave the helmet on. The only exception to that is, as stated earlier, if you have to breathe for this person, a full-faced helmet must come off. At Road Guardians, we can teach you the proper way to remove a helmet.
If you're looking for information you can trust, visit roadguardians.org where you can find our accredited classes.